Hey guys, what's up? Welcome back to the channel. Before we get into today's video, I have two things to talk about. So first, it's been, I guess, about 2 weeks now. I upgraded my iPhone, so that's super exciting. I got the iPhone 11, and I'm hoping that this is like a way better video quality, and I'm hoping that you guys really notice that. The camera is amazing, so that's super cool. I had been using the SE for the last little over 3 years. Great phone, loved it. It finally just decided to die. My power button and my home button were no longer working, so I ended up upgrading to the iPhone 11. Love it. So I'm kind of playing with that, so forgive me if the camera looks a little weird or different. Still learning curve. Yeah, so that's super exciting, except for my bank account, RIP. But anyway, second thing that's super exciting is that 2 weeks ago over the weekend, I went to a 2-day Kinesio taping course. So there's a ton of different types of tape and a ton of different courses out there. I picked a Kinesio taping class because I wanted to learn from the particular instructor that I took it with. Her name is Allison Taylor. She's an amazing OT. I'm a total fangirl, love her, love what she's doing. She explains things in a way that makes sense in my brain. So that course was amazing. I loved it. Highly would recommend a Kinesio taping class if you are looking into hand therapy or you are a hand therapist and you want to learn more about taping. Do it. 100%. You will learn so much. I've been having so much fun the last 2 weeks in my practice, just playing with different techniques and trying different taping on different patients. I'm seeing really good results so far, so I'm excited to start using that more. And if you guys have any questions about that, feel free to comment below. I'll probably link some information on both Kinesio tape and then also a little shout out to Allison Taylor. I'll kind of link you guys to her LinkedIn or her Facebook account because she shares a lot of videos and a lot of hand therapy education and just different treatment ideas. And I, love following her because I see so many new things all the time. So shout out to her. Shout out to Kinesio tape. Loving it. Yeah, so without further ado, let's just go ahead and kind of get into this video today. We're going to be talking a little bit about CMC arthritis, osteoarthritis of the basal joint or the CMC joint of the thumb. So it's right at that super painful little point between the thumb and the wrist. And that's what we're going to talk about today and kind of what I tend to do in my practice with people that have this diagnosis of basal joint CMC osteoarthritis. Let's do it. Okay, so I guess the first thing we should talk about is what is basal joint arthritis. So if you want to backtrack and you need to know a little bit more about osteoarthritis in general, check out one of my previous videos. I'm going to link it below. So go ahead and check that out first. Obviously, basal joint arthritis is just a specific type of osteoarthritis. So it's identifying the location. And I am not an artist, so please forgive me. This is not in any way anatomically correct. I just wanted you guys to have kind of an illustration on a real hand. I'm not an artist, so please take this with a grain of salt. But essentially, in the hand, right, in our thumb, we've got the long first metacarpal bone, and right in this area where it intersects with the trapezium bone, which I drew as a circle. I don't know why. It's definitely not circle shaped, but it's Monday and I've had a long day, so yeah, art skills suck. But that's essentially where it's occurring, right at the base of the thumb into the wrist. So people will often have pain kind of around this back area. A lot of times they'll be swollen kind of in that area. You'll see the joint is really puffy, swollen, irritated. They'll usually localize the pain somewhere in that region. And they might feel like it's more in their wrist or more in their thumb. They might even have pain kind of up into the other joints of the thumb. But essentially, it is joint degradation, right? Cartilage degradation, joint narrowing in between the first metacarpal and the trapezium of the carpals, the trapezium bone. So that's essentially what people mean when they are saying CMC joint arthritis of the thumb or basal joint arthritis of the thumb. It's commonly referred both ways, so it's good to know both of those definitions. Yeah, so that's basically what it is. Another question that I get from a lot of patients is, why does this occur? And there's definitely, again, a lot of different factors. I find that a huge factor in any development of joint degradation and inflammation, cartilage damage, and joint narrowing over time is the way that we're using our hands. So there are definitely other factors to it, but when you think about the thumbs and all of the intricate little things that we do every freaking day with our thumbs, texting, we're doing a lot of pinching, we lift things up with one hand. When I go shopping at the grocery store, instead of carrying 2 bags at a time like a normal human being, I want to save that 3 trips to the car, so I carry all my bags at once. I'm holding, I'm pinching, I'm using my thumbs to do something. It's just use, right? We use our thumbs a ton and we beat up our thumbs a ton. When we're young, we don't normally notice like pain, so we develop all these bad habits of different ways of doing things that our joints are just put in a really unstable position. So over time, anybody is going to have it at some point, right? Because they've just put so much tension and so much force. Some of us will get it earlier than others, certainly. Some people are having it as young as, their 20s, 30s, sometimes the starting signs. Some people aren't getting it until they're 50, 60, 70. So it's not just something that happens when you're old, which is what people always say about arthritis, but it's just not necessarily true. So that's just a very general overview of kind of why it occurs, but it is typically something that can be prevented, or at least, kind of slowed down just based on the way that you use your hands and by doing things in a more safe way for your joints. Another question that I get from a lot of my patients, and then also from some of the newer therapists that, are starting off in their hand therapy journey, a lot of people are wondering, what can hand therapy do for osteoarthritis of the thumb? Because obviously we cannot reverse the damage. Like, once arthritis has started and once that joint space begins to narrow, that cartilage starts to kind of wear down, we can't do anything right now in current modern medicine. We cannot do anything to reverse it. We can prevent it from getting worse, and we can help slow down the progression of the disease. But a lot of our goals in hand therapy especially are pain management, right? Because these people are usually in a lot of pain. We want to teach them, okay, you're going to have this for your whole life. How are you going to get through every day? How are you managing your pain? How are you keeping flare-ups from happening? And when you feel painful, what are you doing to help with that? We also want to make sure we're maintaining their range of motion and their strength as best as possible, right? We're really focused on functional strength here. So things that, not necessarily just sitting down with, your therapy and just kind of going at it, doing a lot of grip strengthening, but we're trying to help them function in their daily life. We know that it takes a minimum of about 20 pounds to be able to kind of have some minimal function. So just maintaining that strength as best as we can to promote function, and making sure that their range of motion doesn't get worse over time, because as movement decreases, they're going to have less function overall, especially at the thumb joint, right? I mean, we have so much movement there, and that's the whole reason humans have thumbs, right? We need to be able to oppose and get that wide movement. So that's a huge key, is maintaining, if they get kind of deformed and they lose their range of motion, that's not a very functional way to be. We want to really have that nice wide web space. So that's really important. And then of course, hand therapy definitely has a huge role in teaching and educating patients on joint protection, energy conservation, different ways to save their joints and to help, kind of get the things done that they need to do without putting their joints in a dangerous position or kind of causing these repetitive movements that are going to make the disease process worse and make their joints get worse faster. So we're trying to really help prevent progression of the disease or kind of slow it down a little bit. So those are all things that we can definitely help with. And of course, splinting too, right? Like, of course, hand therapists are experts in providing custom orthotics, and just recommending even different prefabricated versions. Like I have people that do really well with certain types of prefabricated splints, and they can prolong their function for a long time without needing to go down the surgery route yet, right? We're just trying to help them get through their daily life and be in less pain and have more function available to them. So that's kind of a basic, super rambly, but those are kind of our goals of hand therapy for people that have the CMC arthritis. Those are the things that we're really trying to integrate into their treatment plan. A lot of new therapists have asked me kind of what a typical treatment for somebody with CMC arthritis looks like. And so take this with a grain of salt, because like anything, we all treat differently. There are different theories out there and different kind of thought processes out there. And so I'm going to tell you kind of what I tend to do, or kind of what basic skeleton, I'm going to call it a skeleton of my treatment. But we know that each person varies hugely and their needs vary really greatly as well. And so you're going to have to kind of fill in all those little spaces. I guess maybe like a tree is a better analogy. So kind of, I'm going to tell you kind of like the trunk, that system of the branches, and then you can kind of add in little leaves where you need to. Obviously, each person's different, so you're going to have to plan different treatments for everybody. Not all of us are the same. So anyway, analogies aside, it's Monday, guys. Forgive me. My brain is just like, definitely got the Monday brain today. But anyway, I tend to find that my arthritis patients really, really love heat, and they really, really love paraffin wax most of the time. So I pretty much start everybody. We're lucky in my clinic that I work in now. We have a cold laser unit, or a therapeutic laser. So I like to start with that because I figure it really can't hurt as long as you're following kind of all the kind of guidelines of treatment, and you're not doing it on somebody it's contraindicated for. But I like to use the cold laser. I usually put it in the areas where they're having the most pain that day. People like it. It's quick. It goes by really fast. And then we dip them in the wax, the paraffin wax in the clinic. They love it. They sit there for 10 minutes. They do some deep breathing. They do some relaxation. That heat warms up all their tissues so nice, so that when we go in to get started on treatment, they're feeling happy, they're feeling less painful, and everything is easier to move and easier to mobilize. So that's what I like to start with. Some people, prefer like a hot pack or whatever like that. Moist heat works great too. I like the paraffin because it really coats all of the surfaces of their hands so nicely. It's like a little warm hug. So that's what I like to start with. And then I usually kind of like to get my hands on the patient after they come out of the wax. So I'm not typically starting with ultrasound. I do sometimes, just depending on if I'm backed up a little bit with my previous patient, but I usually like to kind of get my hands on them. That's when I'm going to come in with kind of my lotion, my gua sha tool I really like on some people. Not everybody likes that, but I do a lot of manual treatment in the web space, so I always start there because I find that people get really tight in their adductor muscle, they get tight in their thenar wad, so I'm kind of trigger point releasing them, or I'm kind of trying to stretch them out, mobilize all those little thumb muscles that just get so tight and they just want to be tucked in like that. So we want to open them up a little bit from the thenar wad. So I do a lot of manual treatment there. I'll do like kind of some joint alignments sometimes people are getting kind of rotated at their metacarpal joint, or they're having like really stiff, areas. You got to kind of be careful when you're mobilizing joints and stuff. I don't tend to do a ton of passive stretching on these people unless they really truly need it, or they're not in a huge amount of pain, because, when people are having like joint degradation there, I'm not going to like kind of crank on their joints at all. I'm just usually going to kind of promote them to do more active range of motion. So I'll usually do my manual treatments. And then I'll usually do an ultrasound at that point before I have them do any active stretches or any stability kind of exercises for the thumb particularly. And you can see this in another video too. I tend to give kind of the range of motion of radial abduction, palmar abduction, opposition, making sure they have really rounded circles, right? So a lot of people want to do it this way, and you got to really correct them and make sure they're doing it the correct way. And then I'll sometimes do like a little bit of flexion for them too, or just like an IP block just to get things moving. So that's what I usually start with. Of course, sometimes people need something different than that, and so you can plan for that too. And then as their pain starts to get better, as my treatments start to improve their pain levels, we can start our dynamic stability exercises. So I tend to use a rubber band a lot because you can grade it easily. You can start with a really easy one, like that doesn't have much tension. You can kind of progress from there. I teach them the movements first, making sure that they're doing it correctly. So essentially, dynamic stability program. You should be able to find some information about that too, and I'll look and find a link. But I like to do a lot of I should probably have a rubber band to show you this. Let me get one real quick. So for the dynamic stabilization exercises that I like to do, I like to start having the rubber band kind of over the top of their hand like that. And then what I'm going to have them do is kind of lift and lower. And they're lifting really from the CMC joint. So let me show it from this side too, from the other hand. So again, they're not doing this movement, right? You want them to lift from the CMC joint. So it's really training them to pull the whole thing up. And they're going nice and slow. Just lifting, lowering. Okay. I also like to really strengthen the first dorsal interossei. So what I'll have them do is kind of hold the rubber band, make sure they're keeping their hand really flat. So you can do it flat down on the table. Sometimes they do a little better with that the first time. And then they're just lifting the index finger and lowering. And you can they'll be able to see that or muscle working. So it's really satisfying for people to see that it's working. Okay, so you're just lifting, lowering, strengthening all the muscles around the joint that are going to help them be stable. And then the third exercise that I like to do too, you kind of start the rubber band here. So your pinky is left out. The rubber band's coming down along the side of your thumb. Sorry, I just realized you can't see that. I'm really good at filming YouTube. Maybe show it on this hand. So you've got them kind of set up like this, and then you're going to have them just relax their hand, and then they're bringing it open to make a nice rounded C shape. So again, this direction, relaxed, engaged. Okay. I also make it a big priority to really spend a lot of time each session discussing joint protection, activity modification, using different tools, adaptive equipment. I kind of try to analyze their activities or have them bring me examples of things that they're having difficulty doing, and we try to work through it together and give them really the tools that they need to go on by themselves and succeed, because you can't go with them. They're only probably going to get, in a realistic setting, probably 6 visits, maybe max. In my setting, we get a little bit more sometimes for people. So it really just depends on where you work and what doctor is referring them. But usually you don't need too many sessions for these people. They get it pretty quick. You can kind of teach them how to self-mobilize their tissue. You can teach them how to strengthen on their own, and you can teach them joint protection and activity modification so that they can go out into the world and be successful. So I do spend a lot of my treatment time on that as well, and kind of just reminding, it's all about habits, right? Like, we basically are just creatures of habit, and we've developed all of these bad habits over the years. So it takes a while to break them. It takes a while to retrain them. So just encourage your patients, tell them, hey, as long as you're aware of it, you're going to be more successful. I do sometimes tape people in like kind of a supported stability type of position. And you can also, I've actually done a taping video on that as well. So I found that to be really successful for a lot of people. It just gives them just enough proprioceptive input to remind them to keep their thumb in a good position, and it helps them be more successful when they're active. And just really just encourage them, you know, teach them correct ways of doing things or more safe ways of doing things. They're not going to be perfect all the time, and remind them that that's okay. It's just all the little things throughout the whole day, they really add up. So if you can if you don't care about certain things, like who cares if you open a jar the old-fashioned way, right? I mean, like, who cares? Get like a freaking thing that opens, you know, they sell like all those little jar openers. Like, just get something that doesn't hurt you so that you have more ability to do something that you actually care about later, like painting or like golfing, or I don't know, you know, people have things that it's all about prioritizing. Essentially, it's a game of addition and subtraction. So the more little things that you can simplify or make, you know, kind of more safe for your joints, then you'll have less pain and you'll be able to actually do the things that you want to do. So that's how I explain it to my patients, and they're usually really on board with that too. And then of course, just anything that feels good to them. So just pain relief, ice, heat. Most people don't love the ice. That doesn't usually feel good for them. Electric stim, sometimes we'll do TENS or IFC if that feels good to them. Anything that just gives them a little bit of relief. Taping, splinting, all that kind of good stuff too. I work a lot with people to kind of figure out the right type of orthotic design for them. So a lot of times I just end up recommending like a CMC push brace or like the MetaGrip brace. I really like that splint a lot, and I found that it helps people a lot. But sometimes I'll make like a test splint because they are $80. So they're a little bit more of an investment for a patient to go buy themselves. So I'll usually create something out of thermoplastic that, you know, I tell them, hey, this is just really to kind of get a feel for what the MetaGrip might be like, and it might help save your hands so that you don't have to have the basal joint arthroplasty surgery yet. So people are usually on board with that too, but everyone's different. Everyone's hands are different. So be creative and just try different things. Be willing to work with your patients over the few visits that you do get to see them, and you'll be successful for sure. Yeah, that's pretty much how I go about treatment for the CMC osteoarthritis patients. But there's certainly other things that I do that I'm definitely just not mentioning. So if you have any questions or if you have any treatment suggestions or anything like that, please comment below. I love to hear it. I really do want this to be like a collaborative experience where we all kind of share different treatment techniques or ideas together, because that's how we learn and that's how we grow as practitioners and as hand therapists. And I want all of us to be just the best hand therapists that we can possibly be for our patients. So thank you guys so much for watching. I know this video was very much me just talking a lot, but hopefully you found even one thing helpful. If you did, please like the video. I would love to hear from you. Any thoughts, ideas, suggestions, anything like that that you have, any questions, I'm happy to answer them. And please subscribe to the channel. Your support means so much to me, and I'm so excited to keep making these awesome videos and just get to talk about everything that I do every day, and it's so awesome. Thank you guys so much for watching, and I'll catch you next time.